from an Aboriginal point of view on the question of environmental health, if we have a healthy environment, we have a healthy country, we have healthy people. And the way in which we're dealing with Mother Nature at present is really creating a lot of concern for us as Aboriginal people. And of course we look at that as being also being reflected in the human suffering that's occurring around the country in terms of health. So while we're destroying Mother Nature is not being able to provide for the health and well-being of its children. And as a consequence, we now have these ailing health facilities around the country, and we have a growing health problem in this country. Not only that, we have an ageing population as well who will be desperately in need of health care. I think that for those persons, and having a wife who's experienced, breast cancer and now sort of dealing with that, and having gone through her experiences in chemo and radiation, one of the things we found is that the people who suffer from chronic illnesses as well as terminal illnesses, these people, we need to change the whole system around so that those who can afford to pay for that for health treatment, I believe that the government should look at giving 100% tax subsidies for them, so that it's tax deductible 100%, and that frees up the money then for other people who are in a needier circumstances, and that money should be increased and channeled to those people, so that we don't have people giving up their lives just for the sake because they don't have enough cash to go to these to get those treatments and to travel. And I think we need to increase the level of travel costs as well as accommodation costs and meal costs for those people who are suffering those terminal illness and chronic illnesses, so that it's at least almost on par, or if not on par with what public servants get for driving around this country saying they're doing something for the economy other than getting their travel allowances, topping up their wages, and it's quite significant. So I think we need to re-establish and reorder our priorities in that regard.